Thank you everyone for joining us today. And firstly, I'd like to acknowledge with gratitude that we're humbled and grateful to be living and working on the traditional, ancestral and unceded territories of the Coast Salish peoples, the Musqueam, the Squamish and the Tsleil-Waututh nations. We're really happy to be hosting this event at St Paul's Hospital, one of many facilities that will be positively impacted by the announcement today. And it's my pleasure and privilege to welcome to the podium Honourable Sheila Malcolmson, Minister of Mental Health and Addictions, who will provide us with the details of today's important announcement. Thank you.
Good morning. I'm grateful to join you on the traditional territory of the Musqueam, Squamish, Tsleil-Waututh peoples. I also recognize in Vancouver in particular the Indigenous population that makes their home here and how much they've shaped this city. I'm very glad to be here with Fiona Dalton from Providence Health Care, with Dr. Patricia Daly from Vancouver Coastal Health, and with Mark Haggerty, who's part of Providence's peer rapid access addiction clinic. Very glad to be with these people, with these practitioners, and also feeling very strongly being in Vancouver today, recognized by many across the country as ground zero for Canada's drug poisoning crisis. I want to give a special acknowledgement to the lives lost, to the families, friends and peers who are grieving loved ones, and to everybody who's worked so hard on the front lines to save lives during this particularly tragic year. The amplification of the COVID pandemic with British Columbia's 5-year drug toxicity, drug poisoning crisis has been particularly hard, and my heart goes out to everybody affected. The work on the front lines is so important. The care you give is second to none. And so to be here at St. Paul's to be part of this announcement together is particularly important. Our government wants people in British Columbia to have access to seamless, integrated healthcare to help them navigate the mental health and substance use challenges that they face. We want that care to be available when and where they need it, no matter who they are, or no matter where they live, and no matter how much money they make. Over the past 4 years, our government has been working hard to patch holes in a deeply fragmented system that was neglected for 16 years. And now we are moving beyond filling gaps. Our work is shifting as we begin to make true system-level change. Today, we are announcing a major investment in British Columbia's system of treatment and recovery care for people with substance use disorders. $132 million will strengthen treatment and recovery services in British Columbia across the province and for years to come. This is a 3-year investment, making substance use care easier to access for everyone who needs it in communities across British Columbia. We are building up treatment and recovery services across the continuum of care, including withdrawal management, transition and assessment, treatment, and aftercare. This investment will create more than 65 new or enhanced services throughout BC. It will add more than 130 full-time staff and open an estimated 195 new substance use beds for adults. This is on top of the 100 adult and the 123 youth treatment and recovery beds that we committed to last year, many of which are already operational. Over the coming months, my ministry will finish work with the health authorities and partners to finalize details of implementation of every service in every region that we are investing in. I look forward to visiting all regions of our province as each of these services roll out with our determination to make lives better for people. Some examples of the services that this investment will build and strengthen include new regional residential treatment beds to support women from the interior and island health regions, new vocational and occupational therapists for Fraser Health's adult, day, evening, and weekend, or DO program to support reaching people's substance use recovery goals, and that's both through group and through one-on-one employment-focused services. New peer support initiatives to support ongoing aftercare in locations throughout the Northern Health region. Extension of the Indigenous-led Gwasala na Nakwada partnership program for alcohol treatment and recovery in Port Hardy. And enhancing substance use assessment and transition services at Richmond Hospital and on-site detox to ensure people are more easily connected to services and experience more coordinated and seamless transitions. Also included is funding for 2 new full-time peer support workers right here at St. Paul's Hospital. They will join staff here with the addiction medicine consult team and will ensure care is centered around the patient, that it's culturally safe, and help remove barriers to ongoing care. These are examples of the kind of work that is happening right now, and more examples like this to come. Today's announcement is part of the BC budget from this April 2021, this historic $500 million investment in building that system of care for mental health and addictions that British Columbians need and deserve. And we're building that system from the ground up. Year over year, people will experience real improvements. 2 years ago, we launched Pathway to Hope, which is British Columbia's roadmap for building that system of mental health and addictions care that British Columbia needs and that it lacked in the past. We call it a roadmap for a reason, because it is a journey. Big system level change does not happen overnight, but month over month, we are moving closer to our goal. Today is a milestone along that journey. The work we've done up to this point has been extraordinarily important and urgently needed, but up to now we have been patching holes in that road as we drove over them. And now we are starting to build a new road entirely. Now we get to start shaping our system of care. Getting to this point today is a big day for everyone working in the sector. I'm very grateful to work alongside our health authority partners and our community-based partners and service providers to roll this out. Thank you on behalf of our government to all of you for the life-saving work that you do every day. The connection and the empathy that you offer through shared lived and living experience truly saves lives. It helps so many people at one of the most difficult times in their lives to connect with the services that they need and deserve. I will provide ongoing updates as we move through this system-wide implementation of new and expanded services. There's much work ahead, but we will get there. Our vision of a seamless, integrated system of mental health and addictions care is getting closer. Thank you for being on this journey with us.
Thank you, Minister Malcolmson, for this really positive news for all the regions of our province today. It's now a pleasure to welcome Dr. Patricia Daly, Chief Medical Officer for the Vancouver Coastal region, who is going to also say a few words. Thank you.
I'd like to first of all acknowledge that we're here on the traditional homelands of the Musqueam, Squamish, and Tsleil-Waututh Nations, and for that I am very grateful. I'd like to thank Fiona for hosting us here today, and I'd like to thank Minister Malcolmson for this important announcement. As all of you know, we're in the midst of 2 public health emergencies in the province of British Columbia. The first, the illicit drug toxicity crisis, is now into its 6th year. The second, of course, is the COVID-19 pandemic, which was declared in early 2020. I'd just like to give you a couple of statistics related to these 2 public health emergencies. One of these public health emergencies led to the deaths of 2,000 British Columbians last year. The other caused 3,000 deaths. One of those emergencies caused the death of over 500 people in the Vancouver Coastal region, the other over 800 deaths. And one of those emergencies caused deaths among mostly younger people. And of course, if you guessed that the illicit drug toxicity emergency resulted in the higher numbers of deaths, you would be correct. Here are just a few other statistics provided by the BC Centre for Disease Control. From July 2020 to June 2021, so over a one-year period, illicit drug toxicity was the fourth leading cause of death in this province, behind cancer, heart disease, and strokes. COVID-19 was number 6. And if we rank cause of death based on the person years of life lost, which gives a greater emphasis on those deaths in younger people, illicit drug toxicity deaths ranked number 2 because the average age of death was 44 years. In the first half of this year, overdoses or illicit drug toxicity deaths were the number 1 cause of death for British Columbians 19 to 39 years of age, and the second leading cause of death for those under 19 years of age and those 40 to 59 years of age. This is an emergency that's killing people in the primes of their lives. Now, all of us know that every day, not just in BC, but across this country, we read about the COVID-19 pandemic on the front pages of our newspapers. We follow closely the number of new cases, hospitalizations, and deaths. Unfortunately, even though the illicit drug toxicity crisis is killing more people in this province, once a month we will hear from BC's coroner about the new reported number of deaths. And the crisis has worsened during the pandemic, and yet it is not receiving the same level of public attention as the pandemic. And that's not to say that we shouldn't focus our public health efforts and our efforts through the province, the Ministry of Health, on the pandemic. But it's just a reminder that we need to balance our approach to these crises. In fact, many of the things that we've done to control the spread of COVID-19, many of the public health measures, we know led to increased illicit drug toxicity deaths. Those deaths increased when public health measures were put in place, when people were afraid to access harm reduction services, when some clinical services stopped seeing people in person. And that is one of the reasons why those of us working in public health need to balance our approach to these two emergencies. What we also know is that while we've all been focusing on COVID-19, that Minister Malcolmson and the provincial government have been working very hard to address that other public health emergency, and the investments that we've heard and the some of the recent announcements to support harm reduction, to support new approaches to a safer supply, and now to invest in our system of addiction care are very, very welcome and very needed, because we know that as the COVID-19 pandemic has continued, more people are using substances, and more people are using substances harmfully. They're being hospitalized not just due to opioid misuse, but to alcohol use disorder, to stimulant use disorder, and we're going to have to deal with the ramifications of this for years to come. I'm particularly pleased that the money that was announced today will invest across the continuum of treatment, because addiction is a chronic relapsing condition. It will range from withdrawal management services, detox services, through to recovery services, but also will invest in providing education and support to people with living and lived experience. We know how important it is on the recovery journey for people after they've successfully been through detox, perhaps residential treatment or outpatient treatment, that they continue to have purpose and meaning in their lives. We have initiated programs here in Vancouver, including our street degree program in the downtown east side that provides education to people with lived experience, that allows them to move forward, to have meaningful employment and meaningful contribution to society, and it helps in their recovery journey. I'm also very pleased that this announcement is occurring right here at St. Paul's Hospital. The addiction team at this hospital is probably the finest in this country, and they have worked tirelessly, including through the pandemic, to support some of those who are in greatest need in this province. And I know they will continue to do so as we roll out some of these new initiatives. In Vancouver Coastal Health, we work in partnership with Providence Health Care on our regional addiction program. And the investments announced today will help not just those in Vancouver, of course, and across the province, but in our health region. We will provide better support from Richmond, Vancouver, North Shore, into some of our rural communities to help those who are dealing with substance use disorder. So this is a thank you to the provincial government, to those of you who've continued to be on the front lines of both crises over the last 2 years, including the experts who worked at the BC Centre on Substance Use, our partners, agencies who deliver harm reduction and addiction treatment services, community, and everyone with lived experience who is integral to our response. Thank you.
Thank you so much, Dr. Daly, for your words, and particularly for your kind words about the St Paul's addiction team, which I completely endorse. They do an amazing job. I just wanted to take a minute to speak about how today's announcement will benefit the patients that we see here at St Paul's and how it supports our caregivers. St Paul's Hospital cares for some of the most high-risk patient populations in the region, and we work with people who face severe mental illness, poverty, homelessness, substance issues, and numerous other challenges. In recent years, we're grateful to the provincial government for making important investments at this hospital to support the needs of these patients, such as investments into the mental health hub, the rapid access addictions clinic. But challenges remain in providing peer supports to patients and transitioning them to community supports that best address their needs. So providing more peer support workers and resources at St Paul's, enhancing the addiction medicine consult team and expanding virtual care will strengthen our approach to caring for these priority populations. And as we know, successful patient outcomes is not just about how much we invest in programs and services, but ensuring that the services have a human dimension and that patients feel connected to programs and to caregivers, that they feel they're part of the decision-making process and that they are seen as individual persons. And so as part of this, the importance of having peer support workers can't be overstated. Many of the long-time patients that we see need to feel accepted, and sometimes it's easier to speak to someone who's had a similar experience. And peer support workers have often confronted similar stigmas in the past. We always try to see each person before they see their illness. We try to believe and to always practice building relationships with patients, starting with a first encounter. Instead of starting with a medical diagnosis, starting to get to know what's important in the life of each patient, each client. And we often see our patients for a long time, over a long period of time. And we strive to achieve each patient's goal, perhaps a return to joyful experience, a renewed family relationship, improved day-to-day stability. And so we're so happy to see the ministry emphasise these approaches during today's new investments. The emphasis on strengthening integrated, culturally appropriate, trauma-informed supports in hospitals and healthcare settings, continuing to focus on housing and community resources, will greatly improve patient outcomes. And to speak much more eloquently on this subject, it's my pleasure to invite Mark Haggerty, who's a peer navigator here at the Rapid Access Addiction Clinic at St Paul's Hospital, who can speak very powerfully on this subject. Mark, thank you.
More eloquently, I'm not sure. Hi, my name is Mark Haggerty. I'm a peer navigator here at St. Paul's. So I've had addiction issues for 20 years. Got into recovery about 8 years ago. But I want to, what I really want to thank is Vancouver Coastal Health, Providence Health for creating the RAC program. So when the opioid crisis was deemed in 2016, the Rapid Access Addiction Clinic opened up, and they included peers in that. And I've been blessed to work there since it's been opened, and it's been an eye-opening experience. But also, it's, as Fiona said, it's like giving back to the community. I feel like I was lost in my addiction for a long time, and then to get the support that I needed was great. Now, however, I do see, since we've been here in 2016, the numbers do continue to rise. But if we weren't here, I'm talking about the RAC, they would have risen even more. As they've talked about in the past, alcohol use disorder is on the rise. So there's still many things to do, but getting peer support has always been one of the things I've been blessed to do. But when you're in a hospital, and when people come, and here's the issue with people who've come to the hospital and maybe being turned away. I'm not talking about this hospital, but other hospitals. The stigma of being someone with an addiction. The term addict is thrown out there, or drug seeking. And these are people, I challenge anybody who doesn't know a family member or a friend who hasn't suffered some addiction in their lifetime. But so when people come in here to our clinic or our hospital and they see someone like myself who has come out the other side of addiction, gives them hope. It also puts them at ease. I started as a peer navigator 10 years ago, started with the JRC here at St. Paul's as well. And just to know when someone comes into a hospital and they see someone that is being on that side, it just puts them at ease. There's a trust issue. Or there's been a lack of trust. The role of the peer navigator is an integral one, helping clients to feel more at ease and to trust practitioners, to better understand a treatment plan and, of course, or a course of treatment to feel safe and decrease stigma. I think the most rewarding part of being a peer navigator is seeing people down the road, how well they've come along and how their lives have changed. The connection with clients that we have built over time is meaningful and powerful. We work with, at RAC, the peers also do a lot of the lockdown training. We do that not just with the clients, we do it with family members and also our friends. We also try to get family members connected to their support needs as well, and that could be through other support services in Al-Anon or Al-Anon to help support them. I can easily talk to a family member about what it's like to be an addict, but they already know that. They're already seeing it with their child or their loved one. But they need peer support as well. So peer support, like I said, we started about 10, 11 years ago. And every organization today has some peer support in it, whether it's cancer agency or any other agencies, they have their own peer support. And I can't tell you enough, I wish I had that when I was in my addiction. And I'm so glad that funding is happening, more funding is happening, because it's well needed. And also as an addiction, someone with an addiction, that when I needed help, and this is quite common, there's a small opportunity to get that help. If I had to wait for a detox bed for 2 weeks, that opportunity is missed. But we, as a support here at St. Paul's, we encourage and the peers help navigate that system and also support the clients as best we can. But again, I feel very grateful to be part of the peer system, and I really do feel part of our team at RAC, which does incredible work, and I'm glad it's expanding to the other AMC team in St. Paul's as well. So thank you, everyone.
Thank you, Mark, for those words that remind us all why we're here and why this is so important. This brings us to an end of the speakers portion of the event, and thank you so much for everyone for joining us. We're going to open the floor up to questions from the media, and Elena Banfield is going to organise this bit. Thank you.
Thank you to our speakers today. A reminder to media on the line that you may now press *1 to enter the queue. You'll be limited to one question and one follow-up today. Please also take your phone off mute, as you will not be audible until your name is called. Our first question today comes from Lisa Kordaska with Vancouver Sun. Lisa, please go ahead.
Thank you. Good morning, Minister. You made the remark that this is system-level change. But, it sounds like similar announcements we've heard about, more treatment beds, more harm reduction, which is all fine. But I'd just like you to explain why you're saying this is system-level change.
Thank you to the media who've joined us here today for this important announcement, and thank you again to all the partners that have made this possible. So I would characterize the response over the last 4 years as very much emergency driven. For example, earlier this year, we stood up 100 new adult treatment beds, 95 new adult treatment beds. That was something that was a clear need. Same as a year and a half ago when we stood up prescribed safer supply as a way, as the dual public health emergencies amplified each other, that we needed emergency measures. So that's the work that we've been doing in partnership over the last 4 years. What today's announcement of $132 million being invested over 3 years into the addictions treatment and recovery system represents a step forward and filling the gaps between the different systems of treatment. So for example, as Mark described, when somebody's ready to step forward with detox and addiction treatment, we want to be able to get them into the detox bed quickly. And so we have this part of this announcement today is standing up new detox beds. The transition and assessment part of today's announcement, one of the 4 approaches that is being funded today, that's particularly important on that system side. To have someone, whether it's a peer worker, an addictions medicine doctor or nurse practitioner, or frontline healthcare provider, being there to coach and support the person as they move from detox into treatment and recovery. And then particularly the aftercare work, where once the person has exited their addiction treatment experience, whether that was bed-based or in other forms, to have that care and support to be able to help them locking in what they have learned and avoid the pattern of relapse, as Dr. Daly has alluded. So these are the first steps in building up that system of care that was envisioned in Pathway to Hope, and one that today's the first day of that work, and it will unfold over the coming weeks and months.
Lisa, do you have a follow-up?
Thank you. I'd just like to switch to another aspect of this toxic drug crisis, and that is fatal overdoses. Many experts say that access to clean drugs is what will prevent fatal overdoses. And in that vein, I'm wondering what's happened to the CARRY program at the Crosstown.
Mm-hmm. Yeah, so Crosstown has been doing extremely innovative work. One of the several ways that our healthcare system is now offering people a prescribed safe supply as a way to separate them from the increasingly toxic drug supply. Since the program of the Safe Supply Prescribed program was first introduced just 2 weeks into the pandemic by my friend and predecessor, the first Minister of Mental Health and Addictions, Judy Darcy, we've had overall a 444% increase in people prescribed hydromorphone, one of the safe supply prescription options. So the uptake has undoubtedly saved lives. The work that's happening right now at Crosstown, I think we're going to have news on that, I hope, in coming days. The work that's happening now with the College of Pharmacists to be able to give the pharmacists the confidence that they need about prescribing in a new way will reconnect, I feel quite confident, the 11 people whose CARRY program around healthcare service on the safe supply and addiction treatment front from Crosstown. And I'm happy to get you an update, Lisa, when we've got the final good news. But I'm encouraged how all partners have been working together on this, and thankful, as always, to the practitioners at Crosstown for trying approaches to substance use disorder in a new way.
Our next question is from Moira Witten with the Tyee. Moira, please go ahead.
Hi. Hi, good morning, Minister. Apologies. Thank you for taking my question. I'm going to follow up on Lisa's question again. Could you please clarify, you or Ms. Dalton clarify who was responsible for the end of the CARRY program, why it ended just 2 weeks after its existence was publicized, and whether there are plans to bring it back or expand it in the near future. I just don't think we have a sense of why it actually ended and what the College of Pharmacists has to do with that.
I'm very glad that we have Providence Health Care to speak directly to this because the program is directly under their umbrella. But I'll say again, as I have before, that we want the program to continue. There was no suspension of the program by our government or any health authority. We want it to be successful, and we're all working hard behind the scenes to have the service brought back again to the people that are reliant on it. But we'll have Fiona speak directly to that. Thanks.
Yeah, I just wanted to echo the Minister's words. The situation is complicated in terms of the regulatory and legal position, but we are all on the same side, and we as Providence are grateful for the support of the Ministry of Mental Health, the Ministry of Health, and indeed the collaboration of the Royal College, the College of Pharmacists, and we are confident that we will get to a point very soon where we are able to reinstate this programme.
Moira, do you have a follow-up?
I do, thank you. Also on the injectable and inhalable prescription heroin side, Minister, a number of clinics and clinicians, including Vancouver Coastal Health Authority itself, have said there are still and already hundreds of clients with need for inhalable or injectable heroin options right now in Vancouver and surrounding areas. Your ministry has said it is focused on other substances and alternatives for your safe supply directive that is, being implemented in the coming months. Given that Fair Price Pharma is already in the process of bringing this medication to Vancouver, will the province support its use for the patients who already meet the specific clinical guidance for prescription heroin? And if not, are you okay with this medication sitting on the shelf when people whom it could help continue to be at risk of overdosing?
British Columbia is the first province in Canada that is using a prescribed safe supply as a way to separate people from the increasingly toxic drug supply. We are doing that work as a province within a federal framework. We are learning as we go. So what we've learned starting in March 2020, when the prescribed safe supply was first rolled out in response to the suddenly increased loss of life from the toxic drug crisis. We started with one form of safe supply. We learned as both from healthcare practitioners and from people who use drugs that what they needed more options, both geographically and so far as substances go. That work then carried on until and was announced. I was honored to stand with Dr. Bonnie Henry and announce the next phase of our province's prescribed safe supply program. Already, we are prescribing fentanyl patches and Fentora. Again, nowhere else in Canada is this happening for substance use disorder. In July, I said, and I'll continue to say, diacetylmorphine and prescription heroin is contemplated in the program, and the health ministry is working to secure a domestic supply, but it's not yet something that is built. It's not in this month of the program, it's not yet available, but this is all work that we're doing behind the scenes, doing in partnership, doing on an evidence basis, and we'll have more news on that as soon as we can. We know that people who use drugs and are at risk of overdose need options, and we're determined to build those into our program.
Our next question is from Les Lane with the Times Colonist. Les, please go ahead.
Well, thank you. The director of our place in Victoria was with the Finance Committee a week or so ago, and he talked about treatment in general and said that the current model of temporary short-term care, 30 to 60-day stays, is just ineffective, and a number of his clients just go through this. He said 10 or 11 times, like multiple trips through these programs. Do you think how many of these beds are long-term care, which was what he was advocating, the Italian model?
The 195 new treatment beds that are included in this $132 million investment that we're announcing today, they will have different durations of stay, and we'll have announcements in coming weeks and months on where some of them will be located and what the clinical model will be. But Les, I would say more than anything, the important part of today's announcement is the transition care that's built into a lot of the new programs that the health authorities and people with lived experience have told us that they need, and the aftercare. We've got new vocational therapists that Fraser Health told us that they need, that we are funding, new peer-led trauma-informed education programs in Vancouver Coastal Health, and the aftercare that follows the stay in treatment and recovery to make sure that people are able to live what they have learned and have less risk of relapse. If they do, then our healthcare system will be there to help them and support them. And more than anything, we hear that strength and diversity there is strength and diversity. People need options, and that's a lot of what this $132 million announcement today represents.
Les, do you have a follow-up?
I was just wondering, he also advocated secure care for profoundly disturbed people on the street who are suffering just terrible ordeals, and they are very much a danger to themselves, and it seems like increasingly to other people on the street. The mayor of Nanaimo, Leonard Crowe, your predecessor, advocated exactly the same thing in a recent interview. That people seem to be calling for more options for secure care for people who are quite dangerous on the streets. What do you make of that?
British Columbia's healthcare system already has secure care facilities for people who are a danger to themselves. What is contemplated in our province's approach to increase public safety on the streets, safer communities, but also a better system of care for people who are suffering from untreated mental health and addictions, are closing off the entry points to homelessness, and better facilitating the transition points. For example, at discharge from hospital, can we get people into a more supportive housing situation so that they can stabilize, they do not lose the housing that they've been that we have connected with them, especially places like Vancouver and Victoria, where we have moved so many people out of encampments. The majority of them are succeeding in supportive housing, some of them do not. So none of that is contemplated in today's $132 million investment for treatment and recovery. These are healthcare supports across the continuum of care and across the scope of the province. But in another assignment that the Premier has given me, I am working actively with multiple ministries and with multiple partners and stakeholders on what the Premier has called complex care housing. Some are calling it a super supportive housing, where we bring more healthcare supports to the people where they live, help them stabilize, help them succeed in their rental or a tenancy situation. And if they do need to leave that housing, whether that is for a stay in a treatment and recovery facility, whether it might be a short-term involuntary detention under the Mental Health Act, we don't want them to lose their housing in the meantime, because the most stable place for them to secure after a detention or a long stay in hospital, or even in jail, we want them to be able to, or in remand for custody, awaiting trial, we want them to be able to return to community. That's complex care housing. That speaks to the call that we've had from many community leaders. It is not about secure facilities, but it is about a better connection to treatment. And I will give a shout out to the health authorities, again, who we are asking to fight 2 public health emergencies. They've worked with us to implement and identify what is needed through this $132 million investment that we are announcing today, but they're also working with us on the complex care housing model, because we will be asking health authorities to deliver that complex care housing as another form of service along the continuum of mental health and addictions care.
Our last question today comes from Rob Shaw with Check News. Rob, please go ahead.
Hi, Minister. I'm just wondering, what are the wait times for health authority mental health intake right now, and what are the delays to get a drug treatment bed? And how many more programs, staff, or beds do you need to add to eliminate those delays on top of what you announced today?
Yeah. We want, when people step forward to ask for help with mental health and addictions, we want them to be connected to the care when they need it. As Mark alluded, often there is a very narrow window. We sometimes have vacancies that people are able to step right into, but I think more often we hear people's personal stories that when they reached out for help that they had to wait, and especially the in-between pieces, which we are working here in this announcement today to fill the gap between detox and treatment, the gap between when people leave a treatment and recovery home, do they have housing to go to, and is it back to their old neighborhood or their old friends, or does it represent a new chapter for them in their recovery journey? So that's the work that we are focused on. The health authorities have let us know where their biggest gaps and their biggest wait times are in their systems, and that's what the first investments in this $132 million represent. It's different in different health authorities, different in different communities, and the work that we are doing together with health authorities is tailored very much to where they've got good models, but they just need things to be scaled up so that they can create more capacity. And what they've heard from people on the front line and people with lived experience that is needed in their communities. It's going to look different in every corner of the province.
Rob, do you have a follow-up?
Sure, thanks. In the regular healthcare system, we know, almost up to the minute how long the wait list is for a hip or knee replacement or cancer screening, and then we know and often do reduce that wait list or eliminate it by throwing resources and staff at it. And we also know how many hospital beds we have to meet surge capacity. So why don't we track that in the same way for mental health and addictions? And wouldn't that help us produce a system where you would be able to target resources, or we know how much more money or beds we need to put in to meet that demand?
Every health authority in every corner of each health authority, they know where they have bottlenecks. They know where they need more resources, where they need more practitioners to carry out the work, and that's what this investment today represents, is us responding directly to health authorities' identification of how we can connect more people with the care that they need. I'll say again, though, this is building a system while we are fighting a public health emergency and also fighting mental health pressures associated with the pandemic. And again, I give thanks to people that are doing the hard work, the health authorities and the practitioners on the front line. We are asking a lot of them. If we had already, when we took government in 2017, if there was that system of mental health and addictions care in place already, if there was that continuum of care, we would be closer to the provincial model of identifying wait times for a knee replacement. But without a system of care, without that system built and intact, that is not where British Columbia is, but it's where we would like to get. In the meantime, an investment like today, informed completely by the health authorities and people on the ground's identification of where the need is greatest, and our willingness as a government to partner with them represents a real step forward. And as we've been able to measure success in other areas of pandemic response, the new numbers of naloxone kits distributed, the huge increase in the number of people connected with prescribed safe supply, the huge increase in the number of people that are receiving medication-assisted treatment, our new program to have registered nurses prescribe medication-assisted treatment. Those are all metrics that we're following. And help us measure and evaluate whether our investments, including the ones that we are making today, actually connect people with the care that they need. Evaluation and monitoring is built into every piece of funding that we're pushing out the door, so that we can answer your question in years to come, Rob.
And that's all the questions we have and time we have for today. Thank you, everyone, for joining.